I said I can see. Yes, sir.
Hello students, can you see the screen?
Yes, sir. Yes, we can see, sir.
Hello.
Hello, sir. I can see. Yes, yes. I can see the screen, sir.
Going to study jaundice and its types. We'll study today. This is the topic for today's class. So let's define jaundice. Jaundice. Definition of jaundice, also called as icterus. So we uses the another term icterus for jaundice. Okay, jaundice is also known by medical term icterus, and it's a medical condition. Okay, this is definition of jaundice. You have to learn. Jaundice is a medical condition which shows the yellow discoloration of the skin, mucous membrane, or white of the eyes. So there is a yellow color of skin. The skin become yellow color, mucous membrane become yellow color, and the white of the eye become yellow color. Okay, and this yellow color is because of the excess of the bilirubin. Typically caused by what we say, uh, typically caused by obstruction of the bile duct and liver disease and excessive breakdown of red blood cells. Okay, so this usually happens when when there is a there is obstruction in the bile duct. The bile duct is the duct which allow the passage of bile from liver to intestine, or liver to gallbladder, and from gallbladder to intestine. So if there is obstruction in the bile duct, so usually what happens, uh, the bile duct obstruction can cause can obstruct the flow of the bile, and because of that the bile and the bilirubin may not be able to excrete in the mucous membrane or the white of the eyes, and because of that there will be the color of this skin, mucous membrane, and white of the hepatitis, or it can be the excess breakdown of red blood cells. So these are the different reasons with it shows uh, increased level of bilirubin in the blood, or yellowish of skin, mucous membrane, and white of the eyes. So we have learned the definition of jaundice here, and hope you have any doubt. Is Martin? Is there any doubt for this definition
No
of
doubt, sir.
jaundice?
No doubt, sir.
Okay, coming to the next. How do I know I have a jaundice? So
Sir, you're not audible.
Now can you see now the screen? I hope it is visible to you. So how do I know I have a jaundice? So this is the what the you need to know if you have yellowing of the skin and white of the eyes, eye color and skin color, it becomes turned to yellow color, and the stool color turned to pale yellow color, and again the dark yellow color. So these symptoms may show the signs of jaundice in our body. Okay, so let's know the detail about the causes and symptoms of jaundice here. Here we can see the person here that uh, this is a healthy person with healthy skin color. You can see what it is naturally looks like, but when the healthy person turn to the jaundice, so you can see the white of the eyes turn to yellow color, and skin become yellow color. Okay, right? So this is what happens. So causes of jaundice are acute inflammation of liver, inflammation of the bile duct, obstruction of the bile duct, hemolytic anemia, and Gilbert syndrome. So these are the different causes of jaundice. And the symptom that we have studied, in addition to that, itchiness we already studied. There is a itching in the skin. Okay, the abdominal pain may be there because of the hepatomegaly, weight loss, vomiting, paler than usual stool. The stool become paler, more paler color, and there is a feeling of the fatigue, and the urine become very dark yellow color. Okay, so these are the symptoms. A group of symptoms usually experienced by a person who are jaundice person. So how do I know I have a jaundice? So this is the answer, that if I have these symptoms, okay, so I may have a jaundice. Now, types of jaundice. We are going to know the types of jaundice. Here in the image, you can see it's a prehepatic, hepatic, and post-hepatic. What is prehepatic? What are hepatic and post-hepatic? Let's know about this. So, types of jaundice is a prehepatic, also called as hemolytic, hepatocellular jaundice or hepatic jaundice, and then post-hepatic or obstructive jaundice. So there are three types of jaundice are there. Okay, so pre-hepatic is also called as hemolytic jaundice, and the second is a hepatocellular, or we say hepatic jaundice, and the third one we say the post-hepatic and or obstructive jaundice. Right. So comparison. Let's compare what happens in the this type of jaundice. First of all, let's know what is pre-hepatic. Here pre-hepatic is what the liver is not involved here. Okay, liver is not involved. Okay, and what happens? Actually, uh, am I presenting to you all? Is the screen visible to you all?
Sir, it's dark. It's dark screen. It's dark screen.
Dark screen. Dark screen. What happens? Is it visible now? I hope this screen is visible to you all.
नो सर, नहीं दिख रहे।
Okay. Okay. So this is what we are knowing the types of jaundice. The jaundice, there are three types of jaundice: pre-hepatic, and third one is a post-hepatic or
No, sir.
obstructive
It's
jaundice.
not visible.
So pre-hepatic,
Yes,
here
visible
in
now.
the image you can see, let's point out a pointer here. So this is a pre-hepatic, and here pre means before, hepatic means the liver. So it's a before liver. Okay, so liver is not involved in this kind of jaundice. So because of that we say pre-hepatic, and we call it hemolytic because there is a excess red cell destruction. So we call it as hemolytic jaundice. So here this is the red blood cell which is hemolyzed because of intrinsic factor. The red cell is in, maybe abnormal. Okay, the membrane defect or hemoglobin defect. So intrinsic, defect inside the red blood cell. So it can cause decrease in the lifespan of red blood cell, whereas the hemolysis may occur because of extrinsic factor. The red blood cells may be normal, but outside the red blood cell, the environment is not suitable, like antibody formation, so immune reaction or destruction by immune mechanism, or maybe there is a toxin in the blood, or maybe there is some unfavorable condition for the red blood cells. So by any means, if it's intrinsic mechanism or extrinsic mechanism, if the red blood cells are lysed, but it's not normal, it's excessive lysis we can say. So hemoglobin present in the red blood cells are released, and this hemoglobin further increases, you know, the bilirubin, which is the waste product of hemoglobin breakdown. Okay, so bilirubin is a waste product of what we say hemoglobin breakdown. Okay, so this bilirubin enter the liver cell. Okay, it goes to liver for conjugation. So here in the hepatic jaundice, okay, hepatic jaundice, the liver is abnormal. We can see the cirrhosis. Cirrhosis is a normal condition of the liver. Okay, so where the cells are, replaced by fibrous tissues in the liver, and because of that we say the liver hepatic is what the condition where either there is a cirrhosis, either there is a neoplasia. Neoplasia is like cancerous like condition, tumor like condition, or there can be the viral hepatitis or drugs. Okay, tumors, so many conditions which are involved with within the hepatic, within the liver. So liver is not normal, is because of disease in the liver. It is not able to metabolize the bilirubin, because for excretion of the bilirubin, since we say it's a waste product, it should be excreted out of the body. So for the excretion, it should be, it should pass through the liver first. So liver usually do the conjugation of the bilirubin. It makes the bilirubin soluble. It makes the bilirubin water soluble. And now, if the bilirubin is not, modified or not conjugated in the liver, then it cannot be excreted out of the body. Okay. The third type of jaundice is a post-hepatic jaundice, where post-hepatic, what does it mean? That this is the what we say bile duct, and this is the gallbladder, and this is the pancreas. So this bile duct, there may be the occlusion, obstruction, or there may be the carcinoma of ampulla better. This is the opening in the intestine. Ampulla veter is the opening in the intestine, is a common bile duct. Okay, so opening of pancreas, opening of this bile duct in the intestine, this is called ampulla veter. And if there is a carcinoma of this, so there will be the obstruction. Okay, carcinoma of head of pancreas can also leads to obstruction in the bile duct. Okay, or there may be the gallstone, or cancer of the bile duct, right? So in such cases, the, the obstruction is there, the bile cannot be passed from the liver or from the gallbladder to the intestine. So the bile usually contain a pigment called bilirubin. So the bilirubin which is conjugated in the liver, it is, passed through the bile duct to the intestine. If there is obstruction over there, then this obstruction will not allow the bilirubin to pass towards the intestine. Is it visible to you? Please respond.
Yes, sir. Sir, I have a question, sir.
Yes, yes.
Which is the most common type of jaundice?
Very good. Which is the most common type of jaundice? Jaundice, we cannot predict. Like if you talk about the newly born baby, so basically for that, we can say is pre-hepatic or hemolytic jaundice because there is excessive hemolysis in an infant circulation because they have red blood cells, and that red blood cells are usually having the fetal hemoglobins. And during pregnancy also, what happens during pregnancy also, what happens, a lot of red cells are hemolyzed, and the hemolyzed red blood cells enter into the circulation of the infant, and this result into the excess bilirubin in their body. So it can be the hemolytic type, or it can be the hepatocellular type, because the liver can be immature liver. Okay, if the infant has an immature liver, so those infant may have a hepatic jaundice. Okay, so they may have a enlargement of the liver, so hepatomegaly you can consider. Okay, and this is the what the usually post hepatic jaundice usually occurs in the adult, sometimes even in the children also, where there is a gallstone obstruction in the bile duct. So you, according to your question, which jaundice is a very common, what we say, so we can say it's either for our age, it can be the post hepatic or it can be the hepatic. Okay, but in the cases of the infant, they have the pre-hepatic, or there is an infection of the malaria, which
सर
causes the lysis of red blood. Yes, yes, Amisa.
अशोक यादव
Sorry.
अशोक यादव कौन है ये
Yes, Amisa.
अशोक यादव नाम कोई लड़का नया आया है क्या
नहीं, कहाँ पे?
ये इसमें
कहाँ पे नया आया हुआ? Okay,
अशोक यादव कौन है
he's a staff of GD Goenka University. He's Ashok sir. He's a staff of GD Goenka. Okay. So just listen to the lecture. Okay. What we consider that there are three types of jaundice are there. It's a pre-hepatic, also we call it as a hemolytic jaundice, and the second is a hepatocellular, or the third is a post-hepatic or obstructive. Okay, this hepatocellular we can call them as a hepatic as a term. Okay, uh, the comparison, let's compare the three types of jaundice here. So pre-hepatic, hepatic, and post-hepatic. We are going to compare these three types of jaundice here. So excessive amount of bilirubin is presented to the liver due to excessive hemolysis. This is the pre-hepatic condition, where bilirubins are produced in excess amount because of excessive hemolysis. So when there is excessive hemolysis, the reason can be any reason. Maybe the infection with the malaria, or maybe the intrinsic factor of red blood cells, where there may be the membrane defect, maybe defect in the hemoglobin. So because of the any mechanism, if there is a excessive red blood cells hemolysis, so it causes increased level of bilirubin in the blood. Okay, so this is the pre-hepatic condition. This is the, means the liver is not involved, the liver is healthy. Okay, and we consider it as a pre-hepatic. Okay, where the actual defect lies not in the liver but before the liver, where the red blood cells usually lies excessively. Okay, so there is excessive hemolysis, and this excessive hemolysis leads to production of excess bilirubin in the blood. Okay, so you have understand, I think, the pre-hepatic now. And
Yes, sir. Yes, sir.
because of this, there is a elevated unconjugated bilirubin in the serum. So bilirubin, which comes into the blood, okay, because of the excess hemolysis. So that bilirubin should be, should be conjugated by the liver. but liver has a capacity to conjugate the bilirubin, and since the bilirubin level is very very high, so the liver, it's beyond the capacity of the liver. You know, liver may not be able to conjugate the entire bilirubin, which are excessive in the amount. So because of that, the unconjugated bilirubin means before the conjugation, what are the actual the, those bilirubin which are recently produced from the breakdown of the red blood cells, and we consider it as an unconjugated bilirubin. So elevated level of unconjugated bilirubin will be there in the serum in the case of prehepatic jaundice. So if you measure bilirubin and if you find that unconjugated bilirubin level is high, so we can do the differential diagnosis that the jaundice is a type of prehepatic jaundice, right? Now, coming to the hepatic jaundice, how can we differentiate the person has a hepatic jaundice? So the first thing is that there is an impaired cellular uptake. So the cells of the liver may not be able to uptake the bilirubin from the blood. Okay, there may be the normal, normal rate of red cell destruction. The actual defect lies in the liver. The liver may not be able to uptake excessive or even the normal bilirubin present in the blood. So the bilirubin actually what happens, which are present in the blood, which is produced because of the normal hemolysis. So that bilirubin may not be able to uptake from the from the blood circulation, and since there is an impaired cellular uptake, and there may be also the defective conjugation process, means the bilirubin should be conjugated into the liver. So if there is a conjugation defect, okay, the enzymatic process which causes the conjugation of the bilirubin. So if there is some defect in the enzyme that causes the conjugation process, or it can be the abnormal secretion of bilirubin by the liver cells. So if even though the liver has done the conjugation process, okay, then the liver cells should be able to secrete the bilirubin. So abnormal secretion, there is no normally the bilirubins are not normally secreted from the liver cell. Okay, so these are the different reasons that causes the hepatic jaundice. Okay, bilirubins are usually, you have to understand the bilirubins are the produced at the normal rate. Okay, there is a normal hemolysis. Okay, because red blood cells has a limited lifespan, and after completion of the limited lifespan, like 120 days is the lifespan of the red blood cells. So after completing the 120 days, the red blood cells are destroyed. So after the destruction of red blood cells, hemoglobins are also metabolized, and it produces hemoglobins. So that is the normal rate of destruction of hemoglobin based on the completion of the lifespan. Now, if there is a hepatic disorder, so it may causes impaired cellular uptake of bilirubin. Okay, so cells will not be able to uptake the bilirubin from the blood, or there may be the defect in the conjugation, or there may be the defect in the secretion of the bilirubin from the liver cells. So this bilirubin, this type of abnormalities leads to hepatic jaundice. Okay, because bilirubins are not metabolized in the liver, and that bilirubins may enter into the skin or white of the eyes or mucous membrane, and it causes yellow color of the skin. So the symptoms may show the jaundice. If you do the laboratory test, so here both conjugated and unconjugated bilirubin may be elevated in the serum, because liver is unable to unable to metabolize the normal bilirubin, which is produced at the normal rate. Okay, so maybe so here conjugated as well as non-conjugated bilirubins may be increased in the serum. Now post-hepatic condition, if you talk about post-hepatic, where where there is a normal rate of destruction of the red blood cells, where liver is also normal, but post hepatic means after hepatic means after conjugation, there may be the problem with the bilirubin passage. So bilirubin once conjugated into the liver, so it should be passes from the liver to gallbladder, or from gallbladder to the intestine. So that is the passage, and if there is obstruction in that passage, so that causes increase in the bilirubin into the blood. So impaired excretion, we say impaired excretion due to mechanical obstruction to bile flow. So bile duct, there is a stone, we say bile duct, there is inflammation or some occlusion. Because of that, the bile may not be able to flow freely from the bile duct, through the bile duct, and because of that, the bile or the bilirubin present in the bile may again mix into the blood. Okay, and it causes increased bilirubin into the blood if you do. So here post hepatic condition, we find elevated conjugative bilirubin in the serum, because the conjugation process is normal actually. So conjugated bilirubin becomes higher level, and this gives the comparative diagnosis of differential diagnosis of jaundice as a post-hepatic jaundice. So based on the laboratory test, laboratory findings, we can also be able to differentiate the types of jaundice. Here in pre-hepatic, we can see there is only unconjugated bilirubin is high. In hepatic, we can see the both conjugated and unconjugated bilirubins are high, but in post high. Is it clear? Are you able to hear?
Yes, sir. Yes, sir. It's clear. Yes.
Okay. Next. So this is the physiological versus pathological jaundice. Physiological and pathological jaundice. This is the different kind of classification. Other than what we studied, the three types of jaundice, that pre-hepatic, hepatic, and post-hepatic. Now this is the jaundice which we are going to compare based on the physiological jaundice or pathological jaundice. So what is physiological jaundice? Here, this is seen in more than 50% of all neonates. Neonates means newborn. So more than 50% of all neonates usually they suffer from jaundice, and the symptoms occur after first 24 hours of life. Means when they are born. So after birth, after 24 hours of the birth, the symptoms start to see. And the causes of this physiological jaundice is inability to metabolize bilirubin related to immature liver. So this is the word, the liver is immature. Here the cause, we can say, if we categorize this kind of jaundice, so we can consider them as a hepatic jaundice, because liver is not able to metabolize or conjugate the bilirubin for so liver is unable to metabolize the bilirubin as the liver is immature. Okay, so this kind of jaundice is a physiological jaundice, because the actually there is no disease here. What the development defect, but slowly and slowly the liver may can I think there's a problem. Yes. Is there any problem with the audio? Are you able to hear
Yes,
my
sir. We can
voice?
hear, sir.
Okay, okay. So, okay, physiological jaundice is something which is observed into the neonates, which are seen in more than 50% of cases. And what about pathological jaundice? Here, less common but more serious condition. This pathological jaundice is related to the disease condition. Physiological jaundice is related to the development, immature liver. Okay, pathological jaundice is less common. It's not highly frequent, but if it is a pathological jaundice, so it is a very serious condition. It may lead to serious condition. So infant is jaundiced at birth. Okay, so when there is a birth, So the infant is already jaundiced, or within first 24 hours of life, there is a jaundice in the infant. Okay, and the causes may be related to the hemolysis. Okay, hemolysis in utero related to RS factor or ABO incompatibilities. And there is a hemolysis in the inside the blood circulation of the neonates, and this hemolysis, the red blood cell destruction, you will start from the intrauterine life. Okay, and that intrauterine life hemolysis may be because of the incompatible incompatibility between the RS factor or ABO blood group of mother and father blood groups. Okay, so or what we say, the incompatibility between the blood circulation or blood groups of or blood type of the infant and the mother. Okay, so if there is incompatibilities, okay, let's say the mother is negative and the child is positive. So in such cases, this kind of hemolysis may occurs in the intrauterine life in the red blood cells of infant, and this causes excessive hemolysis. And the infant which are born with this kind of pathological condition, usually they are already jaundiced. So I hope you have understand what is the pathological and what is physiological jaundice. Is there any confusion?
No, sir, no confusion.
Okay. So now there are some laboratory tests are there. Laboratory test, based on the laboratory test, we can diagnose different types of jaundice here. So this is the pre-hepatic jaundice, hepatic jaundice, and post-hepatic jaundice. Okay, and these are the different blood tests. So total bilirubin, here you can see total bilirubin, which is related to uh, increased uh, or total bilirubin is normal or increased in pre-hepatic jaundice. Total bilirubin is increased in hepatic jaundice. Okay, so this is the findings when there is a pre-hepatic jaundice or hepatic jaundice. Okay, so hepatic jaundice and post-hepatic jaundice, the total bilirubin is high, whereas pre-hepatic jaundice, the total bilirubin is normal or increase, just increase. Conjugated bilirubin is normal in pre-hepatic but increase in both of the condition. Unconjugated bilirubin is again normal or increased, but it is increased in the hepatic jaundice. It's normal in post-hepatic jaundice. Okay. So these are the different blood tests, and these are the different observation differentiate that which one is a pre-hepatic, which one is hepatic, and which one post-hepatic. So these are the laboratory. What is a normal bilirubin level? So direct, also called as conjugated bilirubin. So it's less than 0.3 milligram per dl, whereas the total bilirubin it is 0.1 to 1.2 mg per dl. Okay, and the condition of having high bilirubin level is called as hyperbilirubinemia. If the value is higher than this level, okay, then we call it as a hyperbilirubinemia. So I hope you have understand. I am going to end the lecture now because I have another class. Uh, okay, is there any confusion till now? I hope there is no confusion.
No confusion, sir. No confusion.
Okay, okay. Thank you. So I'm going to end the meeting.
Okay, sir.
You may leave now.
Yes, sir. Thank you, sir.
Welcome.